Welcome to Montgomery Heart Wellness, and we have yet another exciting show for you tonight. Tonight, I'm going to be a little less formal than usual because, I do look at the questions and comments in the chat, rather in the comment section, also in the chat as well. And today or tonight, we're going to talk about, or I should say, answer many of the questions that you have. Now, of course, there's so many questions and there are different types of questions, and we'll address questions in different ways. First and foremost, I want to encourage each and every one of you to leave comments and questions, especially questions, because they are very important to us. And the reason questions are very important to us is because I want to know what your desires are, what you want to learn about, what you want to know more about. We generate some topics somewhat generically. However, I want to speak directly to you. So it helps us come up with video show concepts. For instance, the talk on diastolic heart failure and renal failure came up from several questions that were raised about this, and someone actually asked us to do a video. When I looked at some questions, and a number of you did ask for us to do videos, and even though your question may not be answered here, we will do a video on it in all likelihood. So I will say I'm starting a video series on medications. The first of the series will be next week. The reason for that is, as I just alluded to, many of you have a lot of questions about medications. Can you talk about this drug, or when can you get off that drug? Or my doctor put me on 3 blood pressure medications and said I have to be on it for life. What about this blood thinner, et cetera? So there's so many aspects of medications. We're going to cover this in a series. And so starting next week, I'll give an overview on medications, and then we'll have subsequent videos that get into different aspects of medication, such as medication weaning or the like. So I really look forward to doing that because we get lots of questions on medications, and I'm working hard to prepare information for you on that. So without further ado, I'm going to get to some questions that we pulled from the comment section. Excuse me. So first of all, there was a question in the chat. I'm going to throw this up. Natural High. Aloha, Dr. Montgomery. Can a person around 28 years old with a low ejection fraction of 10% strengthen and reverse their congestive heart failure? Do you know of anyone who reversed heart failure? Now, that's a very good question. And by the way, those of you who are in the chat, feel free to put questions in the chat. I may go back and forth with the questions I've had in advance with some of your questions, especially if you're in the chat. Now, the heart failure is a syndrome. I like to think of it as a physiological syndrome where the heart does not circulate blood commensurate to or in accordance to the body's needs. So if the heart has to circulate 5 liters of blood around the body in the course of a minute, and it's only able to circulate 3 liters, then it's only going to be 60% efficient in terms of circulating blood. So maybe you want to go for a walk, a leisurely walk, you may be okay, but if you want to go for a brisk walk, you get short of breath because your blood can't keep up with the amount of circulation needs or circulatory needs or increased circulatory needs with a brisk walk. So heart failure is a syndrome. So I want you to understand that aspect of it. So now when you talk about reversing heart failure, it depends on the underlying cause. So for example, some individuals may have heart failure, or the heart may be weakened or impaired because of an underlying reversible cause. It may be something as simple as the fact that the blood pressure or resistance to flow is too high. So if you can reduce that blood pressure, reduce the resistance to flow, the heart may then be able to circulate blood commensurate to the body's need. Sometimes individuals get a viral infection where there's an acute inflammatory flare. The heart is temporarily impaired and weakened. And so during the time of that inflammatory flare, the heart is weakened, but when that inflammatory process goes away, the heart regains its strength and is able to function normal. So those are some examples where you could have either a natural or sort of a time-dependent reversal of heart failure. In other situation with the blood pressure, it may be a natural nutritional or medication dependent reversal. So the point is that it depends on the underlying cause. So have I seen people have heart failure reversed? Yes. Have I seen people with an ejection factor 10 to 20% go to either normal or close to normal? Yes. We published case series where we've seen individuals reverse, quote unquote, their heart failure. There's a condition known as hibernating myocardium, when the heart is intentionally, if you will, like to use that word, beating less than optimally because it's not getting enough blood. So you may have what's called ischemia, abnormal blood flow. So if you do things to improve the blood flow, some people may like to do a bypass surgery or a stent, or you improve the nutrition, help those arteries open up naturally, then the heart will get more oxygen, more blood, and therefore more oxygen, and therefore it'll start to contract and function normally. So heart failure reversal, one, depends on the underlying cause. It depends on the reversibility of the overall condition, and whether or not the heart has suffered any irreparable damage. So that may be a show topic in and of itself, because I may talk about the different forms of heart failure and get into the nuts and bolts. And by the way, if there's something I say and you have a show idea, please enter it in the chat or the comment section, because we really want to know what you want to know about, so we can give focused videos and address those questions. So much in medicine that needs to be addressed. So anyway, I'm going to go to some of my prepared questions. I see a bunch of questions in the chat. I'm going to look at that as well. Someone said, I was also wondering if Dr. Montgomery would be willing to share any experience he's had with cancer patients due to diagnosis of multiple myeloma. Now, although we're not a cancer center, we actually don't propose to treat any condition, whether it's heart disease or diabetes, etc. From an integrative standpoint, regenerative standpoint, what we do is we help our patients optimize their biochemistry and physiology, help them regain an optimal microbiome to where the body corrects itself. Yes, there's an allopathic interventional component to it. If somebody's in atrial fibrillation, they cardiovert them out. Yes, we prescribe, allopathic medication. Yes, I see patients in the hospital, et cetera, et cetera. So there's an integrated component to it. But I like to think of every aspect of what we do, even the allopathic part, as helping the individual's body halt the progression of the disease, stabilize itself, and optimize its natural healing process. The body heals itself. And so it's not a matter of treating this condition or that condition. It's a matter of optimizing the body's nutritional state, optimizing the body's biochemical state, optimizing the body's physiological state. So if you have cancer X, Y, and Z, I don't care if you have cancer, coming out of your nose. You want to get the body's biochemistry and physiology optimized, and the body will do its job to correct itself. So regarding multiple myeloma, the simple answer is yes. We've had individuals with multiple myeloma come to our center. We put them on an integrative approach to work with them. Well, we had one individual early on who did very, very well with the multiple myeloma, again, by boosting the immune system, having improved renal function, improved cardiac function, improve liver or hepatic function, the body heals itself. So multiple myeloma, like any other condition, can benefit from nutritional optimization as well as regenerative therapies, such as things like ozone therapy and vitamin C. Next question, I'm going to go to another prepared question, and then I'm going to jump to see what's in the chat. I'd also like Dr. Montgomery to discuss the issue of flatulence. That's an interesting one. I have it really bad after eating cruciferous vegetables and beans, and after juicing and with any green juices. I seem to be okay after eating fruit. I've taken Beano before eating cruciferous vegetables or beans, and that seems to just put it off for a while, but it still happens just later. Not only is it a lot, but it's also loud. So it is embarrassing, so I don't eat those around others. So you have to eat that in the closet, and don't go around people for a few days, I guess. Flatulence is a fairly complex topic. What Essentially, flatulence is the passing of gas. You build up gas with bacteria, certain bacterial overgrowth, gas forming bacteria. It builds up in the intestinal tract, and the body has to relieve it. Some of the quick and dirty common contributors to flatulence, I'll say, is bad food combination. So if you look at bad food combination, typically what we have patients do, and you can go to the extreme of having just model meals, just one type of food at a time. So you're not mixing different types of food. That's certainly one thing you can do. The simple thing is that you want to understand the transit time of certain foods. So if you're going to consume fresh fruits or fruit juices, cold pressed fruit, and when I say fruit juice, I don't mean the pasteurized things from the store, but cold pressed fruit juices, those things have a more rapid transit time. Raw vegetables have a more rapid transit time. If you eat like a potato or a high fatty food, whether it's raw or not, it's going to have a slower transit time. So just imagine, let's say you get up in the morning and you have some cooked beans and rice or whatever the case is, and then mid-morning or noon you eat a big bowl of fruit. Those beans and rice are going to go through more slowly, especially if they're cooked, or maybe cooked veggies or cooked potatoes. Then you add fresh fruit on top of that. That fruit's going to want to pass more quickly, but it won't because you have those high, or slow transit time foods. So it'll sit in the gut longer and ferment, and you'll start to develop gas. So that's one contributing factor. Beans, you need to soak your beans, preferably overnight, 24 hours, which can also reduce the effects of flatulence. Cruciferous vegetables, many people react to those differently, and they can cause flatulence. Sometimes cooking or steaming or boiling them can reduce that possibility. So you'll have to experiment and see what's happening. I suspect from this person's question there may be some abnormal food combinations, and maybe you should try to eat your cruciferous vegetables by themselves and see how you tolerate them. Soak your beans, eat them by yourselves, try model meals, and then get into combining. Let me see what's in the chat. Dr. M, is the live chat going to be available for those who can't attend? I don't know. I think I can save the live chat. I'll try to do that. Dr. Remember, the tumor sergeant is making me sick. My body. I'm going to talk about drugs like that in our medication. My legs are swelling a bit. What about swelling legs? If you think about swelling in the legs, there are multiple causes of swelling in the legs. Just to review, circulation, blood goes to the heart in an artery, and they go away from the heart. They go to the heart in a vein and go away from the heart in an artery. And so the systemic circulation, blood or fluid, I should say, blood in the case of blood, comes through the veins. Now there's other types of fluid that's coming to the heart that's coming through the lymphatics. So lymphatic drainage from the lower extremities go up to the heart and empty into the heart. There's also venous flow from the legs and pelvis and the abdomen go up to the heart. So as that flow, if that flow is open and uncongested, then you have normal flow. You shouldn't have back congestion, and therefore you shouldn't have swelling. Now, what leads to back congestion from the standpoint of flow? If the flow through the veins is congested, what could cause that? Well, you can have excess fluid, so there's more fluid that needs to be returned and can be returned given the cardiac output. That's fluid retention. That can be kidney failure. That could be congestion due to blockage of flow through the liver. So if someone has liver disease or liver cirrhosis or fatty liver congestion, then flow through the liver we will be impaired, and therefore everything upstream from that is going to be congested, so it can lead to swelling. And of course, the heart. The right side of the heart feeds blood to the lungs, then to the left side of the heart. If there's congestion anywhere there, that can lead to backflow congestion. You have swelling. So kidney, lungs, liver disease can cause swelling by that mechanism. Now, other kinds of swelling can be due to the venous circulation. So over time, your valves in the veins. So the veins, they don't have as much pressure in the arteries. So when blood is pushed up through the vein, there's a valve that closes to keep it from going back. some people have these veins that wear out. They develop a condition known as venous insufficiency. And so when these veins wear out and some of the smaller veins, then backflow congestion, some of these smaller branches, and you have venous insufficiency that can cause swelling. There are procedures they do called vein ablation, where they close off some of these small to medium-sized veins, force the blood to go through the larger veins, and that can reduce some of the swelling. But venous insufficiency is a common problem. Local inflammation can cause swelling. That local inflammation oftentimes due to the fact that you just have excess tissue and toxin and waste in what we call the interstitial space. That's the space between the cells and tissue, and that swells up because your lymphatics are clogged up. If you're eating lots of junk and lots of trash, the body builds up the trash and it can't flush it out through the lymphatics. Lymphatics is sort of like the waste channel. So think of it as the sewage line. So if your sewage line in the lower extremity gets backed up, then you get lots of spillover waste. As the spillover waste gets there, that more fluid collects, you get swelling. Sometimes a doctor may give you a diuretic, but it won't help that form of swelling. That form of swelling is reduced by reducing inflammation. You have a local reduction in inflammation, and of course, a nutritional detox help that sewage line open up, and then help flow. So there are different causes of swelling, and you want to understand the root cause before you try to address that problem as a problem. Now, so hello, Dr. My husband's very active. Let's see here. Let me look at this online. My husband very active, had a Widowmaker heart attack last year. He is now whole foods plant-based with 43% EF, low blood pressure. How can he increase both? It depends on the cause of low blood pressure. I mean, low is relative. I mean, low might be normal. So I'm not sure about the blood pressure in terms of if you want to increase, unless if the pressure is like, 85 over 45 and he's weak and dizzy and tired all the time, yeah, that's another issue. If the pressure is 90 over 45 and he's energetic and feels great, then that's a normal blood pressure for him. The ejection factor of 40%, it depends on if there's any reversibility. Now, you say whole foods plant-based. We use a defined plant-based diet. You look at some of our publications. We use a food classification system. There's a lot of raw food. There's time-restricted eating, a detox, the integrative therapies. So sometimes it requires a little bit extra than just a regular whole foods plant-based diet. And if you go to our website and look at some of our published work, you can find it, or just Google my name and so look at defined plant-based diet under Montgomery or Najjar et al., and you'll find some of our publications. So sometimes it requires more than just whole food plant-based. Now, someone asked, I wonder if Dr. Montgomery could cover in detail the findings on an echocardiogram and what each metric means, stiffness of the heart and large heart. Now, the answer to this is going to be really a video topic, and I'd like to hear from those in the chat if you'd like for us to do a video series on standard cardiac tests. What do they mean? Their indication, when you should have them. If you're in the chat, you hear this, give us a thumbs up if you'd like to hear a video on that. Regarding this question, what I'm going to do is I'm going to show you a few basic videos. I want you to bear with me because I'm going to have to go toggle back and forth on some videos I've saved on my screen here. So just give me a minute while I bring up a video, and I'm just going to show you some basic videos here. So as I share my screen, echocardiograms is an ultrasound of the heart. And the basic schematic here is, I'll start this video up. So the basic schematic here is that you have different angles. So this is an echo probe. You see here, there's an ultrasound Doppler waveform. And the Doppler, this shows you slice in the heart. So when you look at an ultrasound, you're looking at a 2D image. And we do slices of the heart. And you can slice it this way. As you see, we do a slice here, we do a slice there, we do a slice there, and we can see different sections depending on where we slice it. We can also slice it here long ways. So we call this a cross section. We call this a longitudinal. And so when we do these slices, it gives us a look at different parts of the heart, and we can see the heart contracting. So it's an ultrasound video of the heart while it's contracting. Now, I'm going to show you a couple of videos of echoes that I think that are interesting. So I'm going to show you an echo with a heart that's thick with normal, I would call normal EF or normal systolic function. But it's a little bit hypertrophy. So let's see here. Hold on a second here. I'm going to share the screen. Apologize for the toggling, but I think it's worth looking at some of these videos. And I'm going to do a special on this. So this is, so just to show you orient you, this is the left ventricle. This is the left atrium, the left upper chamber. This is the right ventricle and the right atrium. So this is that slice that goes longitudinally and cuts down. And so you're going to see this is relatively thick. Now, you may not appreciate this, but after looking at lots of echoes, this is on the thicker side, and you're going to see the squeezing and contraction of blood here. In the left atrium, you see blood that goes from here to the left ventricle, and this pushes out to the aorta. It's not quite visualized here. You get a slight glimpse of it. And then the right ventricle pushes out to the pulmonary artery, which is not in this view. So you have blood coming from here to here and here to here at the same time. Although you don't see the blood, you see the contraction of the heart. So I'm just going to play this video for you. So you see how that squeezes. You get an appreciation for a heart that squeezes normally. My next video is going to show a heart that doesn't squeeze very normally, and keep your eyes on how this contracts right there. So anyway, so we'll come out of that, and I'm going to show you the next video. I'm not going to bore you with too many of these, but I want to show you the difference between normal and abnormal. So here's one where you have mild heart failure, and this shows the heart not beating quite as much as the other one. And then I'm going to show you one with severe heart failure in just a minute. So we're going to go with this other one. I wonder if I can just stay in screen share and just show the same one. But all right, so we have this one here. And this one, again, orient your left ventricle, left atrium, right ventricle, right atrium. And notice how this is more dilated than the other one. And notice how you don't see it squeezing in as much. Take a look at that. Squeeze in a little bit. You see a little movement there. Tiny bit of movement there. There's a mitral valve. Now you see a little bit of the aortic valve here. So blood's going from here to here. This is almost like a 5-chamber view. So you see that's a little bit weaker than the previous one. Now I'm going to show you one that has severe, I'm going to show you one that has severe impaired function. And this is severe heart failure. Let me get the video ready. This did not fit in my little video file in my StreamYard, so that's why I'm having to toggle between sharing, because these are pretty large files. So I'm gonna start this over. So we have that. Now here, see, it's much more dilated. You don't even see much movement here. Look at that. Left atrium, left ventricle, right atrium, right ventricle. Right ventricle is more dilated. Barely see it moving. It's just kind of wiggling there. So this is severe congestive heart failure. This is EF is less than 20%. And this is somebody who really needs some work. I'm going to show you a couple more. I'm not going to bore you too much. I'm going to show you one with a leaky mitral valve, and then I'm going to show you one with a blood clot. And I think those will be the two that I'll show you. So here's mitral valve regurgitation, And again, I'd like to get your thumbs up or thumbs down comment if you want to see more discussions on cardiac tests, because we'll be glad to go and put something more sophisticated together for you so that we can share this with you. So here is mitral regurgitation. Now, left atrium, left ventricle, right atrium, right ventricle. Now here's the mitral valve. Now blood is supposed to flow from here to here and from here to here. Now the probe sits here. So everything that's red goes toward the probe. So if you got your ultrasound probe against the chest, you had an echo, you know what I'm talking about, then the blood flow that's coming toward the probe is going to be red. And then the blood flow is going away from the probe, it's going to be blue. So we can see that this is going here and going there. Now, if there's turbulence of flow, then it's going to be a mosaic pattern, it's going to be a mixture of colors. And so you see a turbulence of flow when you have leakage of a valve or stenosis around a valve, there's turbulence of flow, etc. So anyway, here you go. Now, right here, this blood is coming away and it's supposed to be going this direction, but some leaks out this direction. See this mosaic? You got now there's yellow, green, little blue, red. This is leakage, and it leaks all the way back here. And so this is severe mitral valve regurgitation with what we would call an eccentric flow. It's eccentric because it goes to the side instead of straight through. I'm going to play it so you can see it. So keep your eye right there. You guys are going to be echocardiographer readers soon. See how that goes around? Okay, that's mitral regurgitation. That's a fairly significant, I call it moderate to severe leaky mitral valve. And I think that's something that you would look at, you can monitor. Can that be reversed? It depends. As always, there's always a question of what the cause is, but it certainly can be halted from progression by reducing the amount of inflammation. So the last one I'm going to show you is going to be something that we look at a lot. And for those of you who have atrial fibrillation, if you've gone through a cardioversion, you may have had what's called a TEE or transesophageal echo. And this is a transesophageal echo view. The reason we do it is we're looking for blood clots, and I'll show you exactly what we're looking for. So here's a video here. And I'm going to freeze it. Now, this is different. Now, you have a probe, instead of a probe on the chest, you have a probe behind your throat in the back. And so the probe is here, but the esophagus is back here. So the left atrium, which sits in the back of the heart, is going to be closest to the probe, as opposed to when the probe is on the front of the chest, the right ventricle sits in the front, it's going to be close to the probe. So here you're looking at the left atrium as the closest part. And you see here the left atrial appendage, a little fuzzy here, but it'll come, and you see flow going through here, but it stops right there. Flow should go all the way through here and even through here. The reason you don't see flow here, there's a clot here. There's a clot right there. So let me show you. See, that's opacity, haziness there, left atrial appendage. That's where we look for clot. And this person has a nice clot. We would not do a cardioversion on this patient. This patient would go and get an anticoagulant prescription. And we would anticoagulate them first and call it a day, because we would not anticoagulate that patient. So I hope that was somewhat helpful to you. But if you, again, show me thumbs up or thumbs down if you're interested in seeing more. I see quite a few thumbs up in the chat. So we will definitely make a point to do a show on cardiac testing. I think it's important, but it doesn't matter what I think. What matters what you think. But I think it's important. I agree with you. I'll say it that way, that it's important because, you know, oftentimes patient comes in, well, what does this test mean? What is this finding mean? What does that finding mean? There are lots of things that are quote unquote abnormal, but not pathological or significantly pathological. And so I think, you know, putting everything in context is important. Also, there's no one test that gives you all the information. we put these tests together. So talk about cardiac testing from EKGs, Holters, imaging studies, echoes. What do they mean? Why do we do them? What's the indication? Risk benefit ratio, etc., is important. So we'll cover that. So let me. So that was one. So we got this stiffness. How do you think a juice feast would work for autoimmune disease such as multiple sclerosis? Um, Raw detox in the form of a juice feast or a raw plant-based diet, time-restricted eating, or defined plant-based diet reduces inflammation. Um, Multiple sclerosis is an autoimmune-mediated inflammatory condition. And so by reducing inflammation and modulating the immune system, you can counter the adverse effects that manifest as multiple sclerosis. So hopefully that was helpful. Um, um, Mickey mentioned, and here's one comment on someone else in the chat, blood sugar spikes. There seems to be a lot of confusion about whether blood sugar spikes are normal or abnormal after eating, especially they come down shortly after eating. Blood sugar spikes vary. Lots of people have these continuous glucose monitors or CGMs, and we never had these things before. So the technology wasn't available a long time ago. So there's not a lot of data on blood sugar spikes, except for most of the people who have these CGMs have diabetes or some pathological condition related to their metabolism. So they're going to see abnormal blood sugar spikes. And so the point is that the blood sugar should go up. How much depends. What we do know is based on optimal nutrition, a low inflammatory diet, defined plant-based diet, the blood sugar spikes are less severe. We know that because we can show a reduction in hemoglobin A1C in a very short period of time. Let me look at a few questions in the chat. Let's see here. Oh my goodness. You say eat like a rabbit, train like an athlete. Are there limitations to someone with an EF below 50%? I don't think there's a limitation. It all depends on that individual. I have to, look at the case by case scenario. We rarely limit the calories of food intake of an individual. So anyway, what I'm going to do here, these are wonderful questions you have in the chat. I'm going to save them, and gives me great information to come up with show topics in the future. And so I really thank you for your question, excellent comments. There were so many questions. Obviously, I couldn't go through them in the show. This show ran much longer than usual, but there were some wonderful questions, and we will create some videos covering these questions. So don't feel dismayed if your question wasn't directly answered today, because you will likely see it in the form of a video where we'll do a much more thorough job of answering. So I hope this information was helpful and informative. And of course, leave your questions and comments in the question and comment box. If you have any show ideas, please, please, please leave those show ideas in the comments. I have a team. I've put together a team of people to review the comments, and we're coming up with a process where we will work on show development in the context of your questions and comments and suggestions. So I hope that was very helpful. You guys, thank you very much. Thank you so much for supporting the channel. And if you're new to the channel, of course, please subscribe, hit the notification bell, and share. And of course, like. We have 7 likes. We want more likes. That helps with the YouTube algorithm. And of course, if you're a regular, please like and share. I'm sure you know at least 10 to 100 people who can benefit from this information. Until next time, you guys take care. Thank you very much.